Hello, and welcome to my channel. I'm Dr. Carmen McGuinness, and today I'm going to talk about the treatment of sex addiction. The diagnosis of sex addiction often follows marital infidelity, accusations of sexual harassment, or extreme promiscuity. For several decades, sex addiction has been considered a disorder within the fields of marriage and family therapy, clinical social work, behavior analysis, and clinical psychology. The fact that sex addiction was excluded from the DSM-4 and the recently released DSM-5 leaves open the debate over whether problematic sexual behavior is actually an addiction or even a disorder at all. Some relationship experts take the position that it's simply a problem of behavioral excess. There's considerable evidence to the addictive nature of problematic sexual behavior, such as the fact that 83% of those in treatment report comorbid addictions such as drug, alcohol, gambling, compulsive working, hypochondria, and eating disorders. Like these addictions, sex addiction defies self-control, even given aversive consequences such as the loss of friends and family, becoming unemployed because of it, and other financial problems that it may create, and even arrest. Indeed, the obsessive quality of problematic sexual behavior points to obsession, as is the case in any addiction. The diagnosis of sex addiction typically includes a semi-structured interview, 1 to 3 self-report screenings, and collateral assessment information collected from family and friends. A medical screening might also be warranted to rule out possible medical causes of the behaviors, such as hormonal imbalances, excessive use of drugs to treat erectile dysfunction, or steroid use. The clinician pays careful attention during the assessment process to the behaviors of the individuals. Behaviors such as minimization, this is when the client attempts to make it seem as though the problem isn't as bad as it seems. Avoidance, which is when he or she changes the topic every time you start to get close to the heart of the problem. Emotional detachment, this is the I don't really care anyway approach. And of course, inconsistent responses during the interview time. The therapist should also be mindful of the possibility of faking the disorder as a means of escape from the repercussions of common all-garden infidelity or misbehaving. It's true, as with other addictions, that the sexually addicted client can't be helped until he or she asks for help. And so assessment also includes valuation of the client's readiness for the commitment that's going to be required. During the assessment phase, the therapist will also consider the level of care that will be required. This will be determined by factors such as comorbid diagnoses and addictions, as well as the level of commitment to the intervention team. And participants in the intervention team may include family and friends, sometimes an employer if the problem occurred at work, and coworkers. Once assessment is complete, the intervention team members are brought together to prepare for what's to come. This includes the establishment of guidelines and boundaries, which are typically put into writing and either presented to the client or the client is involved in creating these guidelines. Breaking through denial and addressing the pain associated with extreme shame are typically two early considerations once treatment has started. When shame doesn't occur, it may indicate a much higher level of denial, or it could point to a differential pathology such as narcissistic personality disorder or even sociopathy. Intervention also includes setting sexual boundaries and affect regulation, which involves teaching the client how to regulate his or her affect to preclude sexually inappropriate behavior. Once these have been accomplished, the underlying psychological problems are reviewed through various therapeutic means, such as behavioral approaches like cognitive behavior therapy or acceptance and commitment therapy, which is what I use, or the more traditional psychoanalysis. Typically, underlying problems encountered by sexually addicted clients include fears of failure, an inner belief that he or she is invaluable and unlovable, and/or fears of rejection, often co-occurring with obsessive need for attention and approval. Couples therapy is advisable, highly advisable, once the primary client is stable, if there was a couple involved, if this was a matter of infidelity. It should be noted that although it is not within my scope of practice, a 12-step program is another approach entirely different to what we've been discussing that may benefit those with a spiritual belief system. A 2014 comparative meta-analysis that was conducted by Miller and Moyers revealed similar outcomes across program approaches for alcohol addiction treatment and gambling, but this has not been assessed. A comparative study has not been done for sex addiction. I hope this has been helpful. As always, you can book a session or contact me through the links in the About tab. And thank you again for tuning in. If you found this helpful, please give me a thumbs up. Thank you.